Hello and welcome to our Ask an Expert Parent Education series sponsored by Konick and Associates. I'm Dr. Lisa Konick. I am a clinical psychologist and founder of Konick and Associates, which is a group practice specializing in child and family behavioral health and psychological assessment services. Today is the final segment of our autism series for Autism Awareness Month, and it is focused on multidisciplinary therapeutic supports for individuals with autism. And today we have a wonderful panel of presenters who are going to be talking to us about various services from early childhood through life if you have an individual on the autism spectrum. So I'm going to actually introduce our panelists in a moment. If you're joining us, we are recording the series. Please feel free to ask questions in the chat or to unmute yourself to ask a question. It's fine as well. So I'd like to start by introducing our wonderful panel here. And I'll have each of you talk a little bit about your business, your organization. Rachel Lazich is a lead community engagement specialist at Behavioral Perspectives Incorporated. Welcome, Rachel.
Thank you. I'm so excited to be here. My name is Rachel. Again, I do community outreach for BPI. BPI is located in Plano, Oswego, and Aurora with a Lake in the Hills clinic. And then we're in Central Illinois in Champaign, Springfield, and Glen Carbon. So a little company, but a big company at the same time. We do everything from ABA, in-home and in-clinic. Speech therapy and occupational therapy. We also pride ourselves on parent supports. So look forward to our parent support groups, our parent hangouts as we call them, both virtually and in person. Best way to find information about us is to visit our website, www.bpiaba.com. Learn a little bit more information about what we do. And on our adult side, we just launched our adult services. So ABA for adults. Not only you don't need the autism diagnosis to benefit from those services, any special needs adults under the Medicaid waiver would qualify for services. So again, visit our website, find out more about us.
Very exciting stuff that you guys are doing at BPI. And I'm going to have our panelists also put their information in the chat if I haven't mentioned that. Michelle Versten is the pediatric occupational therapist at Rush Kids Pediatric Therapy. Welcome, Michelle.
Thank you. Yes, I'm an occupational therapist at Rush Kids in the South Naperville location. We have several locations, two in Naperville. So there's a North Naperville and South Naperville location. And you can find out more about us at rushpt.com/kids. And we have occupational therapy, speech therapy, physical therapy, both on land and aquatic. And then we recently started having ABA here as well.
Wonderful. And also Christy Winder, who is an outreach coordinator for Cultivate Behavioral Health and Education.
Thank you so much, Dr. Konick, for inviting me. I am Christy Winder. I am a BCaBA, and I am an outreach coordinator for Cultivate Behavioral Health and Education. And we also provide ABA therapy. We have centers and provide in-home as well. Our centers are located in Barrington, St. Charles, Mokina, Naperville, and Peru, Illinois. We have in-home services throughout the Chicagoland area. And we also do a few things that we want to make sure that the community is aware about, such as parent support groups, a hangout group for kids, as well as a virtual little hangout for kids. It's called Cool Kids Club, a little show and tell that they do. So just trying to make sure that we're helping out the community, doing different things, as well as some advocacy things like, porch pickup, food drives, and different things like that. So out there supporting the community and helping everybody out. Thank you again for inviting me.
Thanks, Christy. And for those of you, I mentioned I'm a clinical psychologist. We do a lot of behavioral health support for individuals on the spectrum. So aside from psychological testing and evaluations, we also offer individualized and family therapy for individuals and families on the spectrum. And we start as young as 3 and go all the way through the life course. So we help with, emotion regulation, distress tolerance, anxiety with uncertainty, how to help parents support their children, how to advocate with the school systems, how to help kids manage their emotions and their skills. We do parent support and coaching for behavioral management training. So, acting out, aggression, things of that nature. And we also help a lot with transition planning and liaisoning with schools. So we'll be talking with you today about a general overview of the various therapies that you might seek or be recommended to seek if you have a child on the spectrum. And I want people to feel free to ask questions. We have a lot of information to cover in a short time. We're going to try to keep this to an hour. And please feel free to follow up with more questions because it's hard to encapsulate all the services in an hour, but we'll try to touch on those. And again, feel free to ask questions. So some of the questions I'm going to be starting us off with are ones that have been submitted to us in advance. And we'll start with early childhood. And I'll leave this open for the panel because I believe this is going to apply to everybody. At the early childhood stage, what are the typical therapeutic supports that are beneficial when a child is displaying delays in development? Because that typically is where we get started with our referrals, is there is a developmental delay. Does anyone want to take that on?
I can start with that. So especially with the really little ones, a lot of it is play-based, and we're just kind of offering opportunities for sensory exploration, opportunities to practice motor skills and speech and communication. And it's all very play-based and fun because it has to be motivating for it to be effective. But we do see the really little ones for occupational therapy, physical therapy, and speech therapy as well.
I'll
Anyone
add a
else
little
want to-
bit to that. And I mean, at the early childhood stage, there are options for families. They can be looking into things like early intervention, depending on, when they're starting to see some signs that maybe they might have a little bit of a concern. Reaching out to somebody, even you, Dr. Konick, for, an evaluation of some sort if there's any type of concerns. But the early intervention, ABA therapy is another thing that they can be looking into to see if just for even guidance there. I know, Rachel, you do a whole bunch of just helping parents find that resource that they're looking for, but reaching out for OT, speech, finding out where you might be able to get an evaluation to kind of help guide you. And then hopefully those resources are directing you to, maybe the right lane that you need to look down, and reaching out even to sometimes your school district as well.
And I'll throw my 2 cents in here too. I actually have a son who's on the spectrum and went along with this journey too. Yes, there are all these wonderful services out there, but unfortunately parents don't know that they exist most of the time, especially if this is your first child with special needs. It was my first child with special needs, and having no other special needs individual in my family. This was kind of a blind thing we went upon. I think the best suggestion I can give to parents under that new diagnosis with those little guys and gals is to advocate, speak your mind, tell your doctors what you feel, what you see. And at the end of the day, you're the only one who knows what's best for your kiddo. So if something doesn't feel right, then it's not right for your kid. But we had such an amazing journey with early intervention. I can't say enough about it. PT, OT, and developmental therapy in my home until we secured the autism diagnosis that normally comes a little bit later. And then after that, they opened up ABA services to us. And again, I had no clue what that meant until a doctor intervened and said, this can be really dynamic for your kiddo. So parents, like I said, it is a journey when you first start, but really look into everything that exists out there and listen to those professionals that are navigating you.
I agree with that, Rachel. And I think a lot of times parents come to us in that 3-year-old age range. And I think the early intervention services tend to come into play prior to 3. If you're still concerned, and a lot of times pediatricians are reluctant to recommend services too early. And so parents get that gut feeling that I should have done this sooner. If your child's still having delays in development at 3, they go into the early childhood program, which is often offered through your school district for screenings and evaluations. And you're always encouraged to see, an independent speech, occupational, or clinical psychologist, therapist who specializes in child development to get more of evaluation or screening services. So I think that is an important piece to the early identification.
Well, and Dr. Konick, I think you brought up a good point too, is that there is no wrong time to start. If this is where you're at, again, we didn't get the diagnosis until we were 3. So we didn't know, right? You don't know what you don't know. And I have parents that call to start services when their kid is 16. There's no wrong time to start. If this is when the intervention happens and when we want to pursue therapy to try to gain goals and skills, there's no wrong time to start.
Yeah, I agree with that. And things are going to change over the course of development as well. Another question is, what is the role of, let's talk about the roles of some of these, the role of speech therapy for individuals with autism. Michelle, can you lead us off on that? What are some of the things you might cover in speech?
Yeah, I had one of our speech therapists give me a nice list here. So pre-linguistic skills, including joint attention, turn taking, imitation, eye contact, cause and effect. They work on functional and symbolic play. And then also some alternative augmentative communication systems, or AAC, those communication devices. They help develop those and implement those. And they can also use like picture exchange systems and sign language, functional communication skills, including requesting, protesting, commenting, social language and interactions, articulation, if there's like an accompanying phonological or apraxia diagnosis. And then they can also work on oral motor skills to facilitate reading.
One of the things that we actually recently referred a young man who is a teenager to a speech therapist because he was speaking too rapidly. So I think that's another thing. Anxiety can play into speech, and having that turn taking or waiting my turn and reading social cues is another thing that I think we've referred for speech therapy as well. And that can be at an older age than the typical early childhood service.
And you did mention feeding, and that plays a huge role in for me, an autistic mom's life. My kiddo is a sensory seeker, and so food's a big battle for him. If it's not feeding his sensory, he doesn't want it. So we're talking salty, crunchy, sweet, right? Those are all he wants all the time. And one of the issues we had, which speech therapy was so helpful in, was pacing. Learn to take a bite, chew it, and stop. And so many people don't realize how speech therapy is just more than like how you talk or how you communicate. It also plays a huge role in like how you.
Thanks, Rachel. The other piece that kind of goes along with speech a lot of times we see is OT. Michelle, can you talk a bit about occupational therapy? What might be some of those presenting questions that a person might present to in OT, and how does a typical session look?
Yeah, so occupational therapy, we're working to help the child or young adults do what they need to do every day. So our daily self-care activities, brushing our teeth, getting dressed. It might be some fine motor skills, so buttoning up our shirt, handwriting, those types of things. And then also we get a lot of the kids on the spectrum that have sensory challenges. So we're working a lot on integrating their sensory systems and giving some strategies as well for self-regulation. And so a typical session, most of the time I would say, starts with some sensory regulation. And then once we can get to that nice regulated state, then after that is where we have a good opportunity to practice the motor skills or self-care skills that we need to work on. And then at the end of the session, we'll talk to the parents, give them some strategies or like a home program to work on for the week. And that's usually how it goes. But of course, it's different for every child.
I hear some referral to a sensory diet, which might be, something an OT could prescribe, correct, Michelle? Something that you say, these are the things that the protocol at home.
Yeah. So that's that sensory home program that I was talking about. So we kind of learn what the kid needs and what they respond well to in the clinic. And then we give the parents strategies, sensory strategies or activities to do at home throughout the day to try and keep that nice regulated state throughout the day. And then the parent will come back and say, oh, this worked really well, but this didn't work. And we kind of adjust and modify as we need to.
My practice does work a lot, and I think other behavioral health professionals work a lot with occupational therapy in that sensory processing piece. And one of the things that we also have worked in collaboration with, even with your clinic too, Michelle, is the emotion regulation. You know, we're giving some of those tools from the behavioral health side, helping parents understand emotion regulation generally. You know, tantrums, outbursts, meltdowns are a lot of things that most families that have kids on the spectrum have dealt with. And how that also translates is using that same language from an occupational perspective as well. Can you speak to that for a moment?
Yeah, so we do a lot of the same self-regulation things that you do. So we work with the zones of regulation and the alert system. How high is my engine running? And a lot of times the sensory component plays into that. So if our sensory needs aren't getting met, we're kind of agitated or dysregulated overall. So we're using self-regulation strategies in conjunction with those sensory strategies to kind of get nice and regulated, I guess, to make it easier to handle some of the challenges throughout the day.
And I want to open this question up to the others too, about how do the different disciplines assist individuals with sensory processing? You know, we heard from OT. Christy and Rachel, do you have some comments on that front?
Yeah, sure. I will address that. So with ABA therapy, it's really important that we're collaborating with all of these different professionals, making sure that we hear, you know, what's in their treatment plan, what do they want to address, and then what we can do in addition to that is help support those same goals, make sure that we're practicing some of the same principles, not as the professional of the OT or their speech, but maybe there's certain components of it, like developing language so that the child can learn to advocate for those specific needs. It's really important that they develop other skills that help them reach what it is that they might need, and they're able to get that addressed through multiple different people. So whether it be their parents or another professional that they're working with, or in school or wherever they need to go, that they're able to be comfortable with getting their needs met, as well as other things that we can work on is helping with desensitization to some of those things. We want to make sure that they can go out into their community and they don't have to be fearful about coming across a circumstance that isn't the most pleasurable. So, you know, whether it be sound sensory or taste sensory or texture sensory, you know, we want to make sure that they can feel comfortable when they're going out into those environments. So those can be a part of the treatment plan too, in conjunction with speaking with a speech pathologist or an occupational therapist and the parents, especially making sure that we can address those concerns for each individual.
I mean, absolutely. From my perspective, not only as a professional, but from a parent, what this allows us to do is speak the same language. We're on the same team. And so that's why that multidisciplinary approach works really well. I would say that's one of the benefits that we have in our clinics, is because we are multidisciplinary in our clinics, is that each person on that team speaking the same language to earn those same goals. Now, if you have a non-multidisciplinary clinic, and there's plenty out there, not saying that they do bad, then not saying that. I'm saying it takes someone like Christy to reach out to say, hey, there's value in what they're doing in speech therapy. There's value in what they're doing in occupational therapy. And the beauty comes where we meld it all together, because at the end of the day, it's about getting these kids where their goals are, right? Like where they need to be or where they want to be. It's not always about need with these kids. It's about like wants, right? I want a cup of milk and I want you to know I want a cup of milk. How then do I communicate that to you through my device or through my words or through sign language? It's about advocating those needs and those wants.
Thank you, Rachel. And I also think from a behavioral health perspective, from a psychological standpoint, one of the things that we do is when we work with multidisciplinary teams is to help facilitate that communication, certainly for the families and the parents, but we're also trying to talk about self-awareness. So we're talking about sensory processing. What is happening? How do you read your child? How do you understand what your child is trying to communicate to you when they're dysregulated? And how do you help that child become more regulated? Because unfortunately what we see, and I think everybody would agree, is we see avoidance, escape behaviors, meltdowns and tantrums, because your child is becoming overstimulated and overwhelmed and anxious. So we are trying to also integrate that distress tolerance into that sensory processing component. So our practice and our clinic works a lot with you as a multidisciplinary. Even though we don't have speech and OT on board, we work in collaboration, and I think that's an important piece to keep in mind as a parent, is how does my team communicate and work together?
Dr. Konick, you said it so right. It's that team. It's every person that makes up that team. I mean, I'm that mom that opened it up and I was like, my BCBAs need to come to my IEP meetings. I gave their permission to come because it's so important that we're all speaking the same language. That way it's consistency for my little guy. It makes sense for him that we're doing the same thing at school, that we're doing the same thing at home, and we're doing the same thing when we come to Dr. Konick's office, because we know that that's important. So the more people that you can pull in that all start to speak that same language, that consistency builds, and like your kiddo just will get it.
And I think parents need to also remember that they're an important part of the team. They're the team leader. They're running the show, especially when kids are younger. So we've talked a little bit about ABA, and I want to shift to talk about what is ABA? Explain that to families. We get that question a lot, especially for kids that are newly diagnosed, and we recommend ABA services. What can people expect from an ABA program? And you all have that option in your clinic, so let's hear it.
I don't mind starting on this one. When it comes to describing ABA, I think that could be a really long lecture. So to simplify it, think of it as the science of behavior, and more specifically, what we're talking about here is human behavior. It is a branch of psychology, and really what you want to understand about ABA, it's a practice put into place to target certain behaviors. And sometimes when people think of the word behavior, they think sometimes of behaviors maybe that you don't want to see, but it's really all behaviors. Everything that we're doing, we're engaging in behavior. So it's targeting behaviors that we want to see increase. It's also targeting behaviors that you want to see decrease. And the most important thing about the services that we're providing with ABA is, we're making sure that we make significant changes with those behaviors, and that it has a huge impact on an individual's life. What is important for that individual? What are the goals for that person to feel successful in life, to be able to feel like they can participate, be active in their life? What things will make them feel a part of their community, or whatever their life skills will take them? How can they be active in their communities? So a huge piece of ABA is also data collection. That's like the biggest thing ever. And the only way for us to be able to know that we're actually helping is to make sure that we're taking an excessive amount of data to support that what we're doing is in fact making that significant change. And we want people to achieve those goals. So when you're thinking about ABA, you're going to be always talking about goals, a treatment plan, and are we making gains on all of those goals? So that's, I guess, the best way to try to simplify it.
I can simplify it even more. It's a game changer. It changed everything for us. It went from tantrum, screaming, crying child who would cry at a window for the hour and a half it took his dad to mow the lawn, to a kid that could regulate and communicate and overall just become like this happier human. It was such a game changer, not only for him, but for our family. And we didn't have to live around him anymore. We could live with him. And so I tell everybody all the time is like, I didn't know how to parent an autistic child. I didn't. And ABA taught me the skills I needed to be an effective parent so I could speak the same language as him, because I didn't speak the same language as this kiddo. I knew how to love him. I knew how to just smother him in love, but I didn't know how to parent this kid. So ABA has been such a big game changer for us. Everything from potty training, best kept secret that ever existed in ABA therapy is potty training. They came in and helped me in 5 days. My kiddo went from using diapers to no diapers ever again. 5 days. It helped him with his eating. It's helped him with his communications, helped him with his self-regulation. It is honestly, I think, one of the best kept secrets that's out there. I think it gets a bad rap for things that may have happened in the past. Some old school ABA tactics or whatever they might have been. But what I can tell you is the kids that I've seen in our clinics, the kid that lives in my house, he gets so excited when his therapist comes. He's banging on the windows and he's excited and he knows it's time to play. He looks forward to it. It's play-based. So in general, game changer.
You mentioned something interesting, as you said, some of the older models of ABA, and we can say that in psychology too. The fields have evolved a lot, and I think that a lot of the fields are focusing more on the positive aspects of behavioral support. You know, parenting is more positive. You know, educational feedback is more positive. It's a lot more positive, esteem building. What should a parent think about, as there are a lot of ABA providers in the community? What should they be thinking about as they're exploring some of these AB options? It's very intensive, but it's also, as I'm hearing from parents, I'm hearing from you ladies, it's worth it. It's more than we can do on a once a week session. It's much more intensive. But what should people be thinking about when they're looking to secure a relationship with an ABA therapist?
I'll start off. Make sure you hear the words individualized. It's important that your program is specific to your child's needs. It's not, there's no such thing as a cookie cutter approach. The number of hours that you might be, your child might be looking at as far as treatment plans, it can vary so widely from a couple of hours a week to, you know, sometimes it's much as 40 hours a week. So it's very, very individualized. It's very important that you have good communication. You're incredibly involved. Parents are have individual goals for themselves. It's not just even goals for the individual child, but also for a parent as well, so that they feel supported. I like to talk about it more as a family support, not just an individual support, because the benefits can be for everyone. It doesn't have to be just for an individual. It's so important that you feel like there's a lot of communication. If there's not a lot of communication and you're not feeling that support, it's not necessarily ABA, but maybe you're just not clicking with that particular provider. And that could be for anything, right? You call a plumber, I don't really like the way that felt. I'm not calling that person anymore. Same thing. Like, you got to make a connection. You got to feel like you have that rapport, not only with that BCBA, but all the individuals that are coming to your home. And so does your child need to feel that too. If they don't feel comfortable, like, so Rachel was saying, like, her son gets so excited. It is the goal for us to feel that child or individual say, like, I can't wait till the next session, or they're banging on the door to get in, or, you know, they're a little upset because they have to leave. That's the number one goal. You had so much fun, you enjoyed it, you learned something, you want to come back again. But for the parent, it should feel like I can always contact them. I can always talk to them. I can always revise those goals. I feel like I'm a part of the team because I'm talking about what things are the most concerning to me, and I see it written in the plan that we're going to address those. Now, is it always something that you can address immediately? No, maybe your BCBA should be explaining why certain goals are chosen at certain times, but you know, there are reasons, and those should be always explained. You should understand why always. Why this, why that? Like, they should be able to explain to you, you know, why these things have been chosen, or why the focus is particularly this, or why we think we might go this way. And then also, you should be able to see the data. You should have access to the data. You should see the progress that's being made. So all of those pieces are really, really necessary for you to feel like you're getting what you should be getting out of ABA, but also just, you know, so you can just breathe. So like, I'm getting the support I'm looking for. That feels really good. You know, that's what you want to walk away with.
You said it perfect. You do have to feel like you're a part of that team. And if you don't feel like you're a part of that team, then you're with the wrong people. So when you call a company, do they speak your language? Do you feel warmed and welcome? Like, do you get the warm fuzzies? Like, you should get that when you call someplace. You shouldn't feel like your child's being put on the back burner and that your needs aren't being met. Then that's not the company for you. And then I also think it's so important that you have a relationship with your BCBA. It's so important, that relationship with that BCBA, because they're the driver, right? They're that person in that car seat. You want to feel like they're the driver and you're the co-captain and we're going together. Because if you're not going together, like Christy said, this can go real bad real fast, right? And me as a parent starting on, I know you talked about those goals and advocating for those goals and maybe why we can't get there right enough. I mean, I was such a rookie parent coming into it. I was like, we need to do this now. And my BCB had to be like, well, there's like 14 goals we need to get before we can get there. And then the aha moment happens for us. But I wouldn't have known that if I didn't have a good BCBA that explained that to me, right? I just would have been like, oh, they're kind of a jerk and they won't let us get there. So it is that open communication and is feeling that support. And if you don't feel like a member of that team, then it's probably just not the company for you. You should look for a different provider. It's not ABA. It's probably just that person. It might be a difference of opinion with your BCBA.
I feel like I'm sure Michelle can speak to it too, in the sense that, for speech and OT and same thing, where you want to collaborate, have that good rapport. And that goes along with not only the parent, but also collaborating well with other professionals. It's so important. And I'm sure for parents, you're going to feel the same exact way that you feel like there's good communication between, your child's teacher, their speech pathologist, their in-school speech pathologist, and their private speech pathologist, and, the counselor or whomever the child has exposure to. So it's an important piece as well, that you feel like everyone's in collaboration, everyone's on the same team, and everybody's moving towards the same similar goals.
I have one more ABA question and then we can move on to a few other things. And this is a question that comes up to us frequently. How do I decide between in clinic versus in home?
I can go first. So that's another really big piece that I think comes along with communication with your BCBA. So that's your board certified behavior analyst. There are different things that you can address in different environments. Sometimes a specific environment's really, really important for things like, this is a jargony word, but generalization. So making sure that skills are being developed and then will occur in different environments, because sometimes our kiddos can get rigid or inflexible, or sometimes people just are better in certain environments expressing themselves. So we see in center that Johnny can do X, Y, and Z, but parents aren't seeing it at home. So different environments can bring about different skills, and we want to make sure that those skills can be shown off to everybody everywhere. Sometimes in-home helps support certain types of life skills that maybe can't be addressed very well in center, or maybe center's a really great environment for more social skills, just because maybe the child doesn't have as much access to those social opportunities in home, or vice versa. There's some really great sibling opportunities at home. And so maybe we need to address those things there, or maybe we're seeing certain behaviors, challenging behaviors, and parents need support. So in-home parent support training could be happening at home, because that's really where it needs to be addressed. So really overall, the environment comes down to that individual need again. Making sure that program is developed so that it's meeting the needs of that person, and going to the environments that you need to go to so that you can address all of those different skills. And then sometimes, parents are busy, like they have jobs and different responsibilities and things like that. So sometimes being a little bit flexible and just saying like, okay, if we can meet your needs a little bit more in the home, let's, do a combo center and in home, or whatever kind of needs to happen with that open communication with you and your BCBA.
Thanks, Christy. I want to move on to another question that comes up a lot for us as well. Lots of these questions come up for us, don't they? We often see services offered more readily at the preschool and early childhood age. That's a very common times to enter into speech, occupational, and ABA services. But a lot of times we may see the need for individuals at the adolescent or young adult or even later adult age. How do your clinics or your services and your organization address some of those?
Yeah, I can start with that one. So, I mean, we're working on facilitating independence and success across the lifespan. So as we age, our family situations change, our environments change, our own skills change, and then our needs change. So what we just keep adapting to what's next. We've learned these skills, but now this is coming up. So now we're going to start working on that. And especially in like the teenage years, we can start working on like pre-vocational skills, more working on like some meal prep and hygiene and some of those skills that we all need as we age and need to become more and more independent. And another big one is self-advocacy. I really like to focus on that with some of my older kiddos to make sure that they're able to tell people what they need and not kind of get pushed back and be able to advocate for themselves and their needs.
Thanks, Michelle. Anyone else want to, I know, Rachel, you mentioned that there's, the Medicaid waiver and there's some availability for later life. What is the type of situation you're seeing there and the type of services that you're providing for older individuals?
Absolutely. So transitional planning normally starts at 14 and a half, and that should happen in the school district. So your child with an IEP, kiddos with a 504 may just get special considerations, but not really enter the transitional planning process. So once you enter that process, we're talking about what happens after school, what happens after the bus stop coming. And to tell you the truth, there's not a whole bunch of great options out there. There are people doing wonderful things, but there's not a ton of people doing things. So it's one of the things we really recognized here at BPI. And one of our missions was to fulfill this adult services, an underserved population of individuals, not only with autism, but with special abilities or special needs. How do they get services? How do they get vocational training? How do they ask questions about like sex education and relationship management and, how to manage your money and all those skills we need as an adult, right? And some of us need continued help into our adulthood. Just because we've turned 22 and we've aged out of school doesn't mean I don't need those skills anymore. So those are things that we're addressing in our adult services. So your BCBA not only becomes your BCBA, but they almost become like a coach or a mentor. Like, how do we move forward? So the wonderful thing about this program is it's covered under the Medicaid waiver. So if you live at home, you live in a SILA, you live in an ISC, you live in supportive living, guess what? We can come to you and provide these services. And we're doing it a little bit different too. We're utilizing behavioral technicians and not only BCBA so that we can maximize the number of hours in which we come and we help you. So it could be an individual that's their own guardian or maybe not your own guardian. The wonderful thing about adult services, they're going to happen wherever you're at, and we're going to work on those goals too. Hey, if your goal in life is to be the Walmart greeter, but you're not independent in washing your hands and using the restroom, guess what? We're going to work on using the restroom and washing your hands so that you can eventually get that goal of becoming that Walmart greeter. So adult services are really going to start addressing post what we consider like our pediatric kiddos that come to us, those young learners, but we're really wanting to focus on those lifelong learners. Like, what do you need to continue to work on through your adult lifespan?
Thanks, Rachel. And one of the things that we do in behavioral health is also looking at those transition periods. So transitioning into middle school is stressful for most kids, and it can be very stressful for individuals with autism. Transitioning into high school, transitioning into post-high school planning, whether that be work, vocational, college, or some type of educational program. We really want to help families support their kids through these transitions. So we work independently or individually with the individual who's maybe working through this, has social challenges they don't want to bring up with their parent, but they also may want to work with the parent to say, how do you support your child's development? And then we also facilitate those as a team. We look at that multidisciplinary approach. If you need more intensive supports, you might need to go to OT or a speech or ABA to get that more intensive work, but we also can help, or your behavioral health professional can help you manage some of those on a week-to-week basis, some skill development, and also liaison with your school or your job coach or your employer. So those are things that I think thinking about your multidisciplinary team is important. Thinking about development of skills, social skills is a big question. Let's talk a little bit about where our different organizations can offer supports in terms of social skill development. Anyone want to tackle that first? Michelle?
Yeah, so for me as an OT, I think that for some of our kids with sensory challenges, being able to get to that nice regulated state is very helpful, because then we can attend to our peers and we can focus on our interactions with our peers or the game that we're playing, rather than focusing on the environment. Maybe the environment's too overstimulating, or maybe I need a certain type of sensory input and that's all I can focus on right now. We also can work directly on like social boundaries, physical body awareness. Oh, that's a little bit too close. That makes me uncomfortable. We need to step back, that kind of thing. And then some of the kids that have motor skill challenges avoid playing those sports or playing games with their peers. So we work on developing those motor skills so we can increase the confidence and increase our willingness to be able to go play those games and play with our friends. And then some of the direct social skill training as well, some social thinking, role playing, self-advocacy stuff. And then before COVID, and hopefully again soon, we were, if two people were both working on some social skills, we might, bring our sessions together for a little bit with another therapist, and then we can kind of practice those social interactions.
Social groups are a wonderful way to integrate social skill training into this. And I think the challenge with COVID has been there have been a reduction in in-person groups, which is what a lot of our, I don't want to say kiddos, because these groups can be middle school, high school, and beyond. But I do think groups can be very helpful if they're facilitated by a therapist who is helping to teach during those social interactions, and just teaching at the basics: eye contact, body language, how do you greet a friend, what is expected in a situation in social encounters, and getting some familiarity, and then generalizing that. Rachel, what are some of the things that you're doing in your organization with social skills? And I'll go to Christy next.
Well, social skills are so, I wouldn't say so easy, but they are easier to work on in clinic. As one of the, going back to that question earlier, Christy really talked about those situations where you're able to, have open dialogue with friends around, right? So we do very commonly what other clinics do out there. We're working on in social circles. We have a circle time where we sit down and we read a book. We do a song together. So we're working on those social interactions. We're working on how to greet someone when they come through the door. Working on maybe starting a conversation or initiating gameplay. Gameplay is so important for those younger kiddos of like, not only how do I play, but how do we play together, and how do I ask you to play with me, and what are important things to play? We don't consider that, communication in general, but yeah, it's communication in general, right? Like, we need to know how to initiate this stuff so that we can continue to forge, make friends, build relationships. It starts simple with gameplay.
Christy, do you have any add-ons there?
They said it perfectly. The only other thing is I thought it was really interesting due to COVID that we did have a lot more virtual interactions going on. And because of that, it's been kind of nice that we can work on social skills, not only virtually, but also in person. ABA does try to make sure that if the need is to be developing those social skills. We can do that on a one-on-one basis with their direct support RBT. But then what's great is then you can then see if it transitions into that group setting when you have in-person or virtual. I mean, there's a lot to be learned for everybody on that virtual platform too, to make sure that you're, doing the appropriate interactions and engaging with people appropriately. So it's nice to be able to actually see both platforms being used at this point, where I think prior to that, not that I want it to stay, but it's just nice that there was that social etiquette that needs to additionally be addressed on a virtual platform, because that's sometimes where some individuals just feel more comfortable on that type of platform, but there still needs to be etiquette. There still needs to be social skill development on a platform like that.
I agree. And we actually started, and I know there are others in the community that offer like virtual game nights for young adults or adolescents. And I think those, and sometimes they transition pre-COVID, we're in person. So we're really, even though these might be group activities that are facilitated more for social interactions, they're not therapeutic. A lot of times they can be therapeutic, because we're learning to manage our etiquette. What are the appropriate things to say? How do you greet people when you see them repeatedly over weeks or months? These are people that we have expectations for, so we can work on those in those formats too. And we have an interesting question. Unfortunately, my son doesn't feel comfortable asking dad about adult kind of male questions, and how do we handle that? And are there men on staff at some of our organizations? And that is an interesting one, and I can speak to that initially. Even though we have a primary female clinical team at my practice, and sometimes it can be hard to find a male therapist. It is an interesting problem, because a lot of these young teens or young adults don't know how to broach those questions about life change and their sexuality, and how they feel about dating or relationships, and the changes in their body. So it is important to find a person that they can relate to. And sometimes it might not be a parent, because if they're getting that information from their peer group or on the internet, they're probably being misinformed. Ladies, do you have any comments about that?
I mean, I can tell you, we do have male staff, both BCBAs, RBTs, male staff exists. Having the balance of male and female staff, I think you get the best of both worlds. For a younger kid, it's really important to have, I consider both energies. It's really great for them to learn how to interact with men and women and maybe what those differences are. They learn with those interactions. But for those older kids, I mean, yeah, did you ever want to ask mom and dad about sex? I didn't want to ask my parents about sex. I really wanted to learn somewhere else, right? And if a BCBA can come in and not only give you that support where you feel safe to have those conversations, then we can provide that education, because you're right, if we're looking online, it's probably leading us in the wrong direction. We can really talk to someone who not only seems like they're there to help me grow as in the therapy, but then we also have this connection where I feel safe to have these conversations. So yes, BPI, we have both.
Yeah, we have 2 male OTs here as well.
Yeah, so I think it is. And I also think it doesn't have to be a male. Sometimes your child might prefer a male, but we have had success in kind of broaching that topic and saying, I know there's things that are, if you have a trusting relationship with your therapist, regardless of what capacity of therapist you're working with, I think you can have some success in bridging that question and having some dialogue around it. That was a good question. Let's talk about collaboration with outside providers a little bit further. Schools is a big question. A lot of our clients are involved in either some type of primary school, or they might even be involved in secondary school, college, vocational school. How do your teams collaborate with school teams, or I should say educational teams?
I can start. The most important thing is getting parents' consent, and hopefully parents actually want us to do some collaboration, because the benefit is so huge. And that starts from the very beginning. We're hoping that you're comfortable sharing with us if they do have an IEP or any type of school document, that you're sharing what are the goals at school, what can be addressed, Any other collaboration with any other type of service provider, again, would require consent to be able to speak with those individuals. And we're hoping you invite us to be able to speak with every person, because again, the most important thing is having that collaboration. Your pediatrician is another one that's often forgotten about. That being able to be a part of that, there most of the time, you know, each person on the team is looking for additional reports, information, progress, what the treatment goals are. They want to see that as well. It benefits everybody so that we know that what areas of focus everyone is working on. We're all going to be able to help drive that same car. They're all jumping in the car that Rachel was talking about. The mom and dad are driving that car, really, and everybody else is climbing on board to get to that destination together. And the only way to really do that is to have full communication across your entire team and feeling like you can open those doors to communication. So there could be weekly emails or full team collaboration meetings of some sort. And now that everybody's really good at Zoom, there should be no reason why we can't have those big team meetings. So it's really, really important. And then there's observations that could be had just upon request. You could have a BCBA going to the school, collaborating with a in-school BCBA, the teacher in the classroom, aides, all of that. And that would be great to be able to meet those goals that you're looking for, where we want to see those skills developed across every area where an individual is participating in.
You know, you mentioned that as a very interesting topic, Christy. Can ABA be in school?
Yes, yeah, absolutely. When the doors are open for communication, everybody's on board and feels like we're working as a team, I think is how you're going to successfully be in a school. There's lots of things that can be happening. And honestly, there's more and more what we're seeing is schools hiring on their own BCBAs and team collaborations that are occurring in that exact manner. So there's benefit to be able to have you're similar to, you might have a speech pathologist in school. You might have a private speech pathologist. Similar, you might have a BCBA that's in charge of certain goals that are going on in school. You can have your private BCBA, and you definitely want those two teams talking to each other. But then you can I think Rachel mentioned that earlier, that she's like, I request that my BCBA is sitting at the IEP table with me. Those are really important things, and we can absolutely go in and help. We're not there to tell the teacher, what to do. We want to work as a team. We want to collaborate. We want to make sure that everybody's just in good communication so that we can meet the goals that we need to, but also support each other. What's going on here? What are you seeing? How are you addressing these specific things? How could we work together, and sharing that really important piece, that data, to support that, we're seeing what we want to see.
Great. I have one more. Oh, go ahead, Rachel. And
Sorry, Dr. Konick, and really the true answer of now that Christy wasn't truthful, she was. The true answer is can ABA, privatized ABA, that's the question. Can privatized ABA be in a school? Yes, but if your insurance approves it. Every insurance is different. Every school district is different, and they may or may not allow that privatized person in there, and your insurance may not deem it medically necessary that privatized RBT person or the BCBA or ABA in general is in school, because that's when they go and get their other services. And there are many schools that, like Christy said, do have their own BCBAs now. Now, on the other end of it is there's many schools that contract to have privatized companies like BPI through our school consults come in and provide goal planning, behavioral planning for individualized students or for the school in general. So there's a lot of different ways that schools are now looking at ABA, especially since the influx of social emotional learning in schools. They see the value in it, I think, now more than ever. So more schools are trying to address this, I think, on the ground level. But the actual answer is it's going to vary case by case, school by school, insurance by insurance.
Thank you for that clarification. I know that's an important question for a lot of families, is a lot of the problems might be in school, which is a stressful environment for a lot of children. Going with that, Michelle, this question's directed to you. You know, and a lot of children get speech and OT in school. That might be where they start getting those services. And we have a lot of families that ask us, should I get private speech also, or should I just stick with the school? And how would you respond to that question? When should private speech come in, or OT?
Okay, so schools typically will provide services if school functioning is impacted. So if it's not a big impact on their ability to learn and do what they need to do in school, they might not qualify for services, or they might not receive services. So that's when you would want to come to outside OT or speech. But we also supplement if they do receive services in the school setting, we can supplement that and also work on whatever they're unable to work on, if that makes sense.
No, that does make sense. I think if the educational environment is affected because of a speech or language related concern, then the school would be the primary designated placement for those services. But there often are challenges that expand outside of that scope. And the school goals are going to be written from the educational perspective. If their goals are outside of that, then they would definitely benefit from private speech or OT.
Yes, and also if you feel that the school's not able to provide enough of, because they are limited with how much time they can spend with each child. There's a lot of kids that they need to get to, so if you feel that your kid needs more than that, then you can kind of supplement with the outside therapies.
Thank you, Michelle. And we're winding up on our hour, so thank you so much, ladies. I greatly appreciate all the wonderful information that you shared with us today. Let's go around and share, how can people get in touch with you? Christy.
Sure. The best way to get in touch with us, I did put my information in the chat if you see that there, but just going to our website, cultivatebhe.com, there access for phone numbers, individuals, questions, resource page that has blogs and all types of information that you might be looking for. That's really the best way, that website.
Rachel?
So the best way to reach us is our website, www.bpiaba.com. You can also visit our Facebook page, find a bunch of great parent support on there, but shoot us a message. We respond to every single message, every single comment on our Facebook page. I also put my direct email in the chat box. So if you'd like to email me, feel free to do that too.
Thank you. And Michelle?
Yeah, so you guys can contact me directly, mversten@rushpt.com, or you can go to our website, rushpt.com/kids, or give our clinic a call. Our upfront staff is super friendly and very helpful, 630-585-7337.
Thank you. And our contact is www.konickandassociates.com. Thank you so much for tuning in today. And we are going to be publishing our recorded version of this panel on our YouTube page and also on our Facebooks, so you'll be able to view it at a later time as well. Thank you very much for your time today.